The first thing that I want you to think about when it comes to your pediatric board review is intent. Not your intent, but the exam intent. I'm going to share a huge insight with you that I doubt anybody has ever talked to you about. Every year, smart pediatricians fail the boards, not because they're bad doctors, but because this exam acts differently than the exams you've taken before. It tests different things than what you see on a day-to-day basis, and the intent is different. And if you don't recognize that early in your board prep season, the results can absolutely blindside you. My name is Dr. Ashish Goyal. I'm the founder of Pediatrics Board Review, and if you're here, it probably means that your boards are hanging over your head. You might be confident, nervous, or you might just be flat out scared. But wherever you are, I get it. So keep listening because I'll explain what I mean by exam intent and how it quietly and unknowingly raises every pediatrician's risk of failing, and how this all ties to the types of resources that you have available to prevent that. Now, let me give you a little bit of perspective on who's talking to you. I'm a double-boarded physician, but when I took the pediatric boards the first time, I failed. I did what most of us do. I bought big resources and tried to read everything, and I thought it would all magically come together on test day the way that it had before, but this time it didn't. I saw within 15 minutes of the exam that the content of those big resources, the breadth, and the way they just throw a ton of information at you that you're actually supposed to try to learn, like the other resource that you might be thinking about right now, which has literally over 1,000 pages, is completely out of line with what the pediatric boards expect of you. And those resources, are they capable of producing a pass? For some people, yeah, but for most, it's an uphill battle. So after I failed, I completely changed my approach. I simplified the content. I focused on repetition that's otherwise impossible with the other resources out there. And I completely changed how I approached board style questions for the first time in my life. And my score skyrocketed. It jumped up by 40%. I did so well that the American Board of Pediatrics asked me to write questions for them after they had failed me the year before. And since then, through PBR, I've helped thousands of pediatricians pass on their first attempt, like I wanted to the first time. And that structure, the guidance, it all just makes sense. And because it makes sense, I've been able to help pediatricians who the world would have just written off, like people who'd previously failed 5, 7, and 9 times, like Dr. Pablo Chagoya, who actually passed on his 10th attempt. And they wished that they had started with Pediatrics Board Review. So when I say that I know better than anyone in the country how to help you pass and to do it without a lot of pain and anxiety, I'm not kidding. And I do truly want you to pass. Also, when I talk about the risk categories and our bundles, they're not just some random packages that things people might want. They're different levels and guidance from a single system that work for you, no matter what your chances are of passing and based on you as an individual. I'm going to share 2 things with you. First, I'll give you the ingredients you need to pass the boards. And second, I'll share with you that key insight about exam intent that hit me like a freight train recently. When it comes to the ingredients, most pediatricians come to us with one belief: if I just find the right stuff, the right things to study, the content, I'll be fine. Content absolutely matters, guys, but it's only one part of the triad. After years of doing this, I keep coming back to 3 pillars that make or break you. And pillar number 1 is content. That should be high yield material that you can realistically finish and repeat to actually remember it. Because without repetition, you will not master the content. Pillar number 2 is strategy. It's definitely test-taking strategy, meaning how you read, process, and eliminate answer choices on artificial patients in an artificial environment. But it's also about how you strategically approach all aspects of a high-quality board prep season. And there are so many little nuances that when you put them all together, they can dramatically optimize your board prep experience to get you a pass. Pillar number 3 is about commitment and structure. It's about having a realistic plan based on your busy life and having the accountability to go through that plan. If you only focus on one of these pillars, you can work really hard and still miss the mark. But when all 3 pillars line up, everything changes. That's exactly how our bundles, our categories of support are built. They're meant to give you the right amount of support that you need based on your risk profile, meaning your risk of failing the boards. And please remember that more support does not mean a ton of extra work, because no matter who you are, the bulk of your time will go into reviewing the content. But if your risk profile suggests that you need support in the areas of commitment and structure, And it suggests that you need support in the area of test taking strategy and board prep optimization, and you don't get it, then yeah, you'll be reviewing the content, but you will not be mastering it. You'll have shallow studying. You won't know how to navigate board questions strategically, and you're going to have a stressful exam day, ending with you having a really difficult time maintaining the best version of yourself all the way until the end. Now, here's the part almost nobody talks to you about clearly. So, what is the purpose of the board exams you took in medical school and in residency? Why are the pass rates of those exams so high? The reason is because we need more doctors. And those exams are meant to weed out the people who are unfit to carry that title. So if you do okay, or if you even just scrape by, they're okay with that. But what about specialty and subspecialty exams? Why do so many more pediatricians fail those exams? Well, according to the American Board of Pediatrics mission statement, their mission is focused on, and I quote, certifying pediatricians who meet standards of excellence. So you have two very different ends of the spectrum. The previous exams that you've taken were all about cutting out the bottom of the barrel. This exam is about seeing whether or not you meet the ABP's standards of excellence. And here's what I've seen over and over again. In all of the years that I've been doing this, talking to pediatricians, program directors, and fellows, I have never heard anyone break down the idea contrasting these exam intents like that. When you realize that the American Board of Pediatrics mission says that they're focused on certifying pediatricians who meet standards of excellence, that completely changes the game. It's not about just medical licensure. It's about excellence, and that intent gap is what pediatricians just fall through. We all know that not everyone can be excellent, and that's the reason why good pediatricians and good clinicians underestimate this exam and they fail. I don't want that for you, and I've built my career around helping you become board certified. Now, let's connect all of that to your risk profiles and the support that we can offer you. If you're at low risk of failing the pediatric boards, meaning things like you've never failed a major exam before, your ITE scores are always great, you usually test really well, and you come from a residency program with a first-time pass rate in the 90s or high 90s, you may not need support in the areas of strategy or commitment or structure. You should follow the blueprint that is meant to help you secure the content pillar with a specific set of resources and a specific way to go through them in a painless way. If you're at moderate risk of failing the pediatric boards, meaning things like you had borderline ITE scores, you were never crushing board exams, you were an okay test taker and your residency program maybe has kind of an okay first-time pass rate, or maybe you have just a little bit of test taking anxiety, you should add on well thought out support in the areas of commitment, structure, and strategy to bridge that gap. And please keep in mind that some people who fall into this category are actually high risk because we help you with kind of a manageable set of questions that we ask, but we don't know what's going on behind the scenes. So if you're kind of feeling borderline, then take that higher level of path because I guarantee you are not going to regret it when you open up that passing score report, and you will regret it if it takes you more than one time to take the boards. One repeat failure turns into 2, 3, 4, 5. Don't let that happen to you. And if you're at high risk of failing the pediatric boards, it's okay. Based on my own risk calculator, even though I had never failed an exam, I was still high risk and I didn't know it. And it's the changes that I made to increase my score by 40% that have led to so much of what you get now. You know, the most challenging residents and pediatricians I talk to are the ones that I know are high risk, but they just can't see it or accept it. They tend to be pediatricians who don't score well on exams. They're coming from programs with pass rates in the 80s or lower, and they were told that they are at risk of failing based on ITEs in residency. Sometimes they're international medical graduates and English is their second language. Or maybe they have test-taking anxiety, undiagnosed ADHD, or they've already failed a medical board exam. If that kind of sounds like you, know that high risk does not mean low intelligence or poor clinical skills. It just means that you have to get the right support that's going to change everything about how you prepare for this exam. You're going to finally understand what the question writer's intent is, how to find weaknesses and patterns in board-style questions, and get questions right when you don't even know that much about a subject, and how to get deeper levels of studying in the same amount of time to maximize your every effort. You are going to have a perspective shift. I promise you. It's going to be like this fog just disappears after a couple of days. Now, let me bring all of this together for you. I hope that you see that I have thought about how to help you a lot. This exam is not just asking, are you safe enough to be a doctor? It's asking a different question. And that question is, do you meet our standards of excellence as a pediatrician? So think about the exam intent. Think about how the risk of failing this board exam is going to be higher for literally every pediatrician, and get the right level of support to satisfy that intent, because that's exactly how our bundles are built for you. I really hope that you'll sense the sincerity in my voice. I hope that you assess your risk profile, and I really hope that you follow the plan that was created with you in mind by somebody who has truly thought about how to help you pass more than any other pediatrician on earth. And if you're watching this on the PBR website, go through the risk calculator and find your path. If you're watching it somewhere else, just head over to pediatricsboardreview.com/risk and get started now. The earlier, the better. And if you have any questions that you think my team, who cares just as much as I do for our members, or I, can help you answer, reach out. Go to pediatricsboardreview.com/contact, and you'll find out why our members love us as much as we love them. Thank you guys for listening. My team and I are here to support you no matter where you are in this journey, and we want to be here to celebrate your pass when you get it with our support.